Welcome to everyone for this latest Asia Society program on the pandemic. We are delighted to have Dr. Ashish Jha, who was just introduced by Anjali again. He is one of the clearest, most lucid voices on this pandemic and breaking down the complexities of it. And so it's very important to hear his take on COVID, the present, and the future. I just want to note that today there was some very good news, which Dr. Jha will talk about, but there was also a very solemn reminder of where we are in the pandemic. In Washington, the National Cathedral rang its bell 900 times to commemorate the 900 American deaths during the pandemic. And if you just think about it, 900 is a huge number, but I was reading an article about the logistics involved, and the person ringing it has to actually press the button 900 times. It can't be programmed, and it takes about 90 minutes. So these bells were ringing out over Washington for 90 minutes, which is probably the single longest memorial throughout the year, even on Memorial Day, I would say. So that's one indicator of where we are. When Dr. Jha and I last spoke at Asia Society was in March, so 11 months ago. And that really seems in some ways like a decade ago in terms of what we've been learning and experiencing through the pandemic. You know, at the time, the vaccination was still in its early days. The Biden administration was young and determined to eliminate the virus. And, you know, I don't even think we had the Delta variant yet, although I could be wrong. In some respects, though, the infection rates and infection trends and hospital trends were similar back then as they are today. They're both declining. And so, Dr. Jha, my first question is, you know, at the time in March, you had responded to a Twitter challenge to write a happy story in 4 words. And given that those trends were declining at the time, yours was, quote, "This pandemic ends soon." So 11 months later, how would you describe where we are with COVID?
Jonathan, thank you. And thank you, everybody, for having me back 11 months later. It does feel like a lifetime, doesn't it? So much has happened. And I've reflected on that statement in a few different ways. One is to think about what was I thinking, what was underlying my mental model, and then how has that mental model changed? Obviously, the pandemic has not ended. And I'm happy to talk about where I think we are. But my mental model at the time was, it was March, vaccinations were going like gangbusters. Everybody seemed to be interested in getting vaccinated. And what we knew was as a society, we tend to have 2, 3, 4% of the population that doesn't want to get vaccinated from things, but 90 some odd percent do. And I had applied that mental model to this vaccine rollout. And so I projected out that by May or June, 90, 95% of Americans would be vaccinated, adults, soon kids. Delta variant was starting to rage in India, but we didn't know that it was a Delta variant at the time. We hadn't identified it. And obviously Omicron was nowhere in sight. And I want to start off by actually saying I got that wrong. I don't think the pandemic did not end. And there were multiple facets behind it. One certainly was a sense that I overestimated how many Americans would be willing to get vaccinated. Second, Delta and the ways that it affected not just unvaccinated people, but also people who are fully vaccinated but not boosted, I think was surprised a little, a bunch of us that it caused breakthrough infections at the rate that it did. Fast forward to where we are. And what we have seen with the virus, and I'm happy to get more into the details of this virus has evolved and kicked off more variants than I think almost every expert expected. Mm-hmm. And at this point in the pandemic, I think most smart people have decided they're going to get out of the prediction business of what the virus does next. Omicron has come out of left field, not kind of part of the evolutionary pathway. And so when I look at where we are today, here we are in early February. Infection numbers are declining, hospitalizations are declining, deaths are starting to turn. And you have a sense that we're beyond the Omicron surge. I think the prediction of what will the virus do next is a is a foolhardy one. It's not one that's worth making. And therefore, my mental model today is we should have some good weeks, months ahead. We will likely see more surges. We will likely see more variants. And instead of being in the prediction business, we should get into the preparation business. And we should figure out what are we going to do to manage all of those things as we get into the months ahead. So long answer to your question, last point maybe is this pandemic has been, I think, humbling for all of us. There's a lot that we have learned about this virus and the ways it has evolved. And staying humble is a really important part of being able to be effective in both understanding what's going on and how to communicate it with people.
Right. And we will definitely get into the steps you think are important for preparation. On the good news side, as you said, we're likely beyond the Omicron surge. Today, New Jersey lifted mask mandates, I think, for schools. Delaware started to move to do that as well. Other states and cities have been doing that. And I know that you support keeping schools open. But at the same time, that may engender, I think, a desire by people to perhaps discount some of the concerns. And I just want to read you, a big story, some lines from a big story in the Washington Post that here's word for word: fatigued, frustrated, and frazzled by 5 surges over 2 years. Some parts of the US population have decided to simply live with the coronavirus and move on. Right? That one line. The other one is, elected officials no longer even talk about conquering the virus, as President Biden did just 7 months ago. So attitudes are changing on both sides, but what are the risks to this notion that at this point we can just move on?
Yeah. Well, the bottom line is that we can learn to manage the virus, learn to live with the virus. But the key word there is learn. If we use the term learning to live with the virus as a code for ignoring the virus, that will be very, very difficult. And the reason it will be difficult, let me lay out in very stark terms why we don't get to decide to just move on. What will happen if we don't do our job? And I actually think it's very much within our capability now to learn how to live with this virus. But if we don't do those things, what will happen is we will see surges. Large proportion of Americans remain unvaccinated. A large proportion of Americans remain unboosted. Many of them will end up in the hospital. Our hospital systems will get overwhelmed. That is what we saw in December and January of this year. And when that happens, it's really bad, not just for people with COVID, but for everybody else. You need cancer surgery, you need heart surgery, you have appendicitis, you're in a car accident. It turns out our healthcare system does more than just take care of patients with COVID. So there are very large societal costs of not managing this and deciding that we're going to move on without putting in place the things that will allow us to move on effectively. So at this point, what I'm saying to people is we do not need to live like it's 2020. But we also do not have the luxury of living like the virus doesn't exist.
Right. And actually, I would just like to remind or inform the audience that we will be happy to take your questions. Please send them through the chat screen and I will incorporate them during the conversation. Sorry, I didn't mean to interrupt that. The point you just made, the phrase learning how to live as opposed to ignoring it, that is crucial. And that gets into sort of the fog of war. We've been battling this pandemic as if it's a war, and sort of the critical front line in that war is science. So there seems at times to be this fog about the science of things. And there's a legitimate debate in the scientific medical community. And then there's the misinformation. Both can cause confusion. And I'd like to drill into those a little bit, first starting with the public health establishment. The Annenberg Public Policy Center recently did a survey that showed declining confidence in the CDC, declining confidence in Dr. Anthony Fauci, and for some reason, the FDA has about the same level of confidence at 74%. Is this lack of confidence sort of warranted in your view based on the discourse, the public discourse that you are seeing?
Yeah, it's a great question. There are two or three things going on, Jonathan, that are happening at the same time, and they require different solutions. So one, I think we should be very clear that there has been a concerted, well-organized effort to undermine the scientific agencies, to spread misinformation. And even if the scientific agencies had performed brilliantly and perfectly, that effort to undermine it would still exist. And there are many tactics that misinformationists use, right? They will take the CDC guidance from June of 2020 and show that it's different than the scientific guidance from the CDC in December of 2021 and claim that it is inconsistent. In fact, guidance should change over time as we learn new things. So there are people who are actively undermining these agencies, and I don't think we should let them off the hook and say, but at the same time, I actually want to take a moment to say, if we just stop there, we would be doing ourselves and the American people a disservice. That, in fact, these agencies, as terrific as they are in the terms of the people who are there, they are peacetime agencies, and we are in a wartime situation. Both CDC and FDA, I believe, have failed to deliver what we needed in this pandemic. Not because there aren't great people or they're not trying to get it right, and not even the politicization, which we can talk about, which has happened a little bit. But ultimately, they were not agencies designed for a moment like this. And so we need to take the time to think about these agencies, how we need to restructure them, how we get them ready, so that future health crises can be managed much more effectively. Those are separate issues, but misinformationists definitely exploit one to further the agenda of the second.
Before we get deeper into misinformation, though, are there things that the Biden administration could have managed better in terms of marshaling the message? Now, obviously, yes, they were fighting a political front at the same time, but are there a few things that they could have done better, and there are things that they can do better going forward?
Yeah, absolutely, on both. So let's talk about what they could have done better. There is no question that they could have done better on certain public health measures, efforts, much of last year. What are they? Number one among them, in my mind, is testing and widespread availability of testing. And we saw this come to a crisis in December and January, when basically people could not get tests and were waiting hours in line or trying very, very hard to get them through CVS and Walgreens. This was a mistake. I don't know what else to say about it. They just blew it on testing. And they've had a change of leadership in the testing kind of office at the White House. And I'm very optimistic that the new person leading that effort, Tom Inglesby, really gets it. But the proof will be in the pudding. I think that was one. And I'm talking about the big stuff. Another big, I think, issue was around messaging. You asked about messaging. In May, when the CDC said that vaccinated people no longer need to wear a mask indoors, there should have been clarification. It's interesting because they've gotten beaten up about that. I actually don't think that was the wrong decision. The problem was that the communication should have been, and if in the future we find large amounts of spread happening among vaccinated people, or we see real surges, we will ask people to put masks back on. That communication up front would have gotten people ready, so that when masking needed to happen again, people would not have been surprised. So much of communication is about telling people what might happen in the future and how to prepare, so there isn't whiplash. I think there have been a series of those kinds of things where clearer communication from the White House, from the CDC, would have been very helpful.
And conditioning the population to expect changes and to accept that nothing is absolute, I think, because people were tired. They want a definitive end. They want to return to normal life. I mean, you referenced in one of your, in something you wrote, or maybe on Twitter, this Lancet study that looked at COVID responses and outcomes in different countries, and found that they couldn't really isolate any difference in terms of the actual treatment or test. Obviously, some countries tested sooner and better and all that. But what seemed to be the differentiating points were trust in the government and trust in fellow citizens, which is what has been undermined by the sort of the politicization of the vaccination effort and this misinformation. So talk a little bit more about the misinformation and how it's basically hurt confidence in both of those things.
Yeah, no, and there's a really important study that just came out. Ezra Klein has a really nice piece about it in the New York Times, I think yesterday or the day before, but last couple of days, that really lays out the limits of policy. That you can have whatever policies you want, but if people don't trust government, if people don't trust each other, the policies and their implementation are really limited. And I think it's a powerful, powerful piece. Misinformation and disinformation come from a variety of sources. Some of it is very well coordinated and organized by foreign actors. Russia and China as two major sources of disinformation spreading in our communities. But there's also a ton of misinformation that is much more kind of politically driven for short-term political gains. And all of it undermines and confuses people, undermines people's confidence in the scientific process. And frankly, it just leaves people unclear what to do and what to believe and whom to believe. And in that context, it's very, very hard for people to know how to keep themselves safe, their family safe, whether to get vaccinated, not get vaccinated. And one of the kind of last points on this, Jonathan, is this is why I have largely shied away from blaming unvaccinated people, because the powerful misinformation campaign that they have been subjected to has persuaded a lot of people that vaccines are harmful. They're not. And we need to understand the roots of that campaign and counter it and not blame the individuals who have essentially been poisoned by it.
Right. And it as you said, misinformation comes from many places, including the medical community. People who are doctors are willing to talk out beyond their expertise. And I know that that's caused some confusion. It's also, it's been, science is getting mocked by the disinformers every day in multiple media outlets, including Donald Trump Jr. tweeted today, mocking Stacey Abrams for appearing at a school without wearing a mask. And his quote was, "Why is the one person who's truly at risk of COVID the only one not wearing a mask? Trust the science." In other words, he's again blaming the scientific community instead of the person. And I don't know the circumstances of what was there, but again, it's science remains under attack. But it's also subjective. I want to get to a question that someone has sent in on this point. The attendee says, Bill Maher, in his closing monologue recently, encapsulated some of the big areas that public health got wrong. I would hardly consider him a misinformation pusher, nor a member of the far right or conservative party who has pushed misinformation. But there are, these different guidance have been wrong and caused confusion. And so how does the government or the authorities sort of step up and own them? Yeah,
it's a totally fabulous question. I saw that monologue by Bill Maher. I agree. I don't think he's trying to be a misinformationist. I think there were some parts of that were not quite right. And let me address some of it, but then actually get to the heart of the question, which I think is fundamentally important. One of the things that Bill Maher did, which I was frustrated by, was, he said things like, well, we were told in February of 2021 X, and it turns out by January of 2022 that that's not true. Yeah, that's because the circumstances changed. The virus changed. In February 2021, it did not look like there were going to be large numbers of breakthrough infections, that they were going to be pretty infrequent. Right. But vaccine immunity waned. We got more contagious variants. And so all of a sudden, we saw a lot of waning. That's not a failure of public health. And I do think that Bill Maher was being sloppy about that, because to claim that that's somehow a failure of public health, in my mind, is a problem. That said, let me get to the heart of this question, which is about owning things. And again, I've spent a lot of time thinking about things that I should have done better, that public health authorities should have done better, that the government should have done better. We should have done a better job of explaining to people that over time, the vaccine efficacy could wane. I think a lot of us worried about that, but did not do enough to communicate that. So when it did, people were surprised, and they shouldn't have been, and we should have communicated that more effectively. And then there are things that the public health authorities have just gotten wrong. The CDC has gotten how virus transmits around surfaces. Remember all the stuff about cleaning groceries, and all of that turned out to be totally wrong. It took us way too long to explain it. So there are several things going on in my mind. One is a principle of crisis communication, which is you need to explain to people where you are uncertain, how you're going to get better information, and how you will update as you get new knowledge. I think public health community has not always consistently done that. There are second things. This has been a really complicated pandemic, and there are things that none of us have quite gotten right. I think being open and honest about that is actually a really important part of building trust. And too many people across the political aisle, but certainly in the public health community, have not been willing to own the mistake. So I think the person asking the question is right on. The substance and the heart of that question is really important. I have a little gentle pushback on Bill Maher. I think he was being a little bit unfair, but you're right. He's not a misinformationist. And most importantly, we all could be doing better on this.
So what are 2 or 3 things that you recommend for people listening to this program today, but also for the government? What are the next steps to prepare?
Yeah. Okay, so good question. So here's how I think about it. Let's talk about it for individuals, and then let's talk about it for policymakers. Here's my mental model as of today. I expect more variants. Why would we not? I expect a surge of infections, whether it's small, medium, or large, we don't know, in the south, in the southern part of the country over the summer, as we've seen each of the last 2 summers. And I expect a surge in the fall and winter in the northern half of the country for a variety of reasons that we can walk through. But those are reasonable expectations. I expect ongoing waning of immunity. I don't know that we're going to need a 4th dose. I'm pretty skeptical, but that there may be better data on that. But the point is that we're in for a period of time where we're going to have to actively manage this virus. And so then the question is, what should individuals do? For me, my kind of recommendation is you should stay up to date on vaccines. That's sort of probably the number one thing you can do for yourself. Number 2 is during a period of surge, and there's a lot of infections happening in your community, wear indoor masks, masks indoors. I think that's a good thing for you to do to keep yourself safe. And then the other part is keep your government accountable for the key things they need to be doing. So here's my kind of 4 or 5 things that the US government should be doing. We should absolutely be stockpiling therapeutics. Therapeutics are a really important part of our way out of this pandemic, right? So monoclonals, drugs like Paxlovid from Pfizer, Molnupiravir from Merck. I say that with a little bit because it's not turning out to be quite as good as the Paxlovid from Pfizer. So making sure we have plenty of doses of therapeutics. Because if we can turn this virus into something that you get infected, you get sick, you call your doctor, you take a 5-day course of pills and you get much, much better, that's terrific. It really lowers the risk. Second is we found ourselves with a shortage of tests. That should not happen again. And the US government's doing a better job on this. I want to see a stockpiling. Next time there's a surge, flood that area with testing. Third, I want to see a new generation of vaccines. Our current vaccines are terrific. They've held up really well. But I think we should be testing not just Omicron-specific vaccines, but things like intranasal vaccines, which I think will have a different level of immunogenicity profile that could be quite powerful. Pan-coronavirus vaccines that are beginning to get developed that would work against a wide variety of variants. There's a whole lot of new work to be done on the technology of vaccines, and I'd much rather see that work than a 4th or a 5th dose of the same vaccine. Stockpiling masks. And then the last but not least from the government, very clear communication that in the future, we may need to have periods of time where we won't need to do lockdowns again, I don't think, but we're going to need maybe mask mandates for short periods of time, where we may need to have ubiquitous testing for short periods of time, that we're going to manage surges through these public health measures. That communication is really important so people are not surprised when that happens.
And I think you've said that you believe the Pfizer vaccine will be approved soon for children under 5. What impact is that going to have, and how should parents be thinking about this?
Yeah, I think for parents, it'll certainly help a lot. So we haven't seen the full data, obviously, so I don't know for sure what the FDA advisory panel is going to do. We're all going to see the data in about 7-8 days, so hold tight. And on February 15th, the advisory panel will meet and vote. And then CDC will also get its advisory panel to meet and vote. I think there are a couple of things happening. I mean, first of all, thankfully, 0 to 4-year-olds are lower risk. That said, I think there's still a lot of anxiety among parents, and I think there is good reason to get kids vaccinated even in that age group in terms of reducing risks like the multi-system inflammatory syndrome that we see in kids who've had COVID. So I think it's going to help. The question will be, what will be the uptake level? How good is the data? We're going to know more in the next few weeks.
So yeah, someone asked, they wanted clarification on what's going to happen in the next 7 to 8 days. That's going to be the data on the clinical trials? Exactly.
So there were initial data did not meet kind of efficacy kind of threshold. So I think all of us were saying, well, we got to wait until we get better data. We're not going to give kids vaccines that don't work. Since then, during the Omicron surge, there's been a lot more data generated in kids 0 to 5 or 5 and under. And I want to see all that data public. I want to see it out and scrutinized by the advisory committee, but also by those of us who are on the outside. And then we'll see what the advisors to the FDA decide.
We just have a few more minutes. Quick question on China from one of our listeners. So as opposed to the US policy of gradually opening, China, which of course is hosting the Olympics right now, has a zero COVID policy. I mean, how do you assess that? And also, given the fact that the Chinese vaccine doesn't seem to be as effective as Moderna and Pfizer when it comes to Omicron. So are they going to see an Omicron surge after the Olympics, perhaps?
Really good question, both Jonathan and the person who asked it. I will start by just saying, I don't understand what the Chinese leadership is thinking at this point. Omicron is so incredibly contagious. I think zero COVID to say it's not a realistic strategy would be an understatement. It's just not sustainable. I don't know how long China would need to remain in lockdown, or certainly they would need to keep themselves walled off from the rest of the world for years. My best guess, because the people running the Chinese government, including the health ministry, are smart people and they must have a strategy. My best guess is they know their vaccines don't work very well. So what they're doing is suppressing it using these public health measures. But then we're also working on the next generation of vaccines, including mRNA vaccines. It may be that they're waiting to vaccinate much of their population with better vaccines before they start allowing Omicron to spread more readily. Again, I don't have a good sense. The only thing I will say is the current strategy, as we see it, will not work over the long run.
Right. So last question. You said you want to get out of the prediction business and you advise that for everyone else. So I'm not going to ask you to predict anything on a timeline, but you have said that we are not yet out of the pandemic into the endemic stage. What are the public health indicators, metrics that might indicate that we are finally entering an endemic phase, like with the flu?
Yeah. Well, part of the problem is that no one can agree on what it means for something to be endemic. I mean, there are definitions, but even the definitions disagree with each other. The way I think about it is that we probably have and again, predictions, complicated, a couple of years of what I would think of as sort of tumultuous times, periods of time we're going to have to deal with unexpected surges, new variants. And at some point, the virus will settle down. But it's not even necessarily the virus will settle down. It will, but also that we are changing along the way. That at this point, probably 90% of the American population has some immunity to this virus, whether it's through vaccinations or prior infections. That makes us a very different host. The key thing to understand about infectious diseases and pandemics is that it is an interplay between the agent and the host. Mm-hmm. We are the host. We are changing as well as the virus. So I expect that whatever happens over the next couple of years, we're going to be much better shape to manage it. We also have our scientific capability around vaccines, therapeutics, testing, all the other stuff we've talked about. And so it may be a little while before things really settle down. But that does not mean we need to remain in this emergency phase, that we can begin to take a very proactive approach to managing this virus in a way that lets us do the things that really matter in our lives, seeing friends and family and gathering for social events and going to indoor concerts and all the stuff that matters. We can do those things now, I think, while we're still actively managing a pandemic that is taking much longer and is causing a lot more suffering and heartache than I think most of us had hoped it would.
But to be clear, even for vaccinated people indoors, you advise wearing a mask.
Oh, I would say during surges, sure. But during a time where infection numbers are low, I think it's probably fine not to. And then part of it is you have to understand, if you choose not to, there's a small chance you might get infected. And the good news is if you're vaccinated and boosted, you'll do okay. That's a good place for us to be as a people, that infections will not lead to severe illness and death. One quick thing, I know we're at time. I just finished a couple of weeks of clinical service in the hospital. Saw a whole lot of COVID patients, lots of people who were unvaccinated, lots of high-risk people who were vaccinated but not boosted. I did not see a single boosted person in the hospital during my entire time. That's what we want to get to. Right. That's what we want to get to, and I think we can.
And I think that's a critical message that needs to be conveyed and believed. Anyway, well, thank you so much for your time. I wish it could go on longer. I mean, there's all kinds of new things happening today, including the New York Times report on how white-tailed deer are possibly carriers and hosts, and what implications that has, as well as your ideas about population surveying through wastewater and sewage. Anyway, lots to explore. I want to thank you, and to our listeners, I urge you to seek out wherever Dr. Jha is appearing and talking. You will have the latest reliable information, very trustworthy. And with that, I will turn it back to Anjali. Thank you very much.
Thank you, Jonathan.